Okay.
This is Amber recording for Lindsey for Trach Care.
Okay, I'm going to first start by reviewing my physician's orders. I'm going to check the chart and check with my patient to make sure they don't have an allergy to latex or anything else that could hinder this procedure from taking place. I'm going to walk into my room. I'm going to perform hand hygiene and apply gloves. I'm going to provide privacy for my patient. Here it is. I'm going to check with my patient.
And I can apply
I'm going to introduce myself. My name is Lindsey. I'm going to be your nurse today. I'm going to check the two patient identifiers. Name and date of birth, please. Yeah, thank you very much. I'm going to then let my patient know that today we're going to be sectioning out your trach and as well as replacing your inner cannula. How do you feel about that? Oh, you get it done all the time? Perfect. Glad you're comfortable with it then. I am then going to look at my tube, look at the condition, make any notes, any redness of the skin, and then I'm going to assess my patient's lungs. Signs or symptoms of airway obstructions, respiratory rate, as well as depth. Sounds great. Then I'm going to remove my gloves. I'm going to perform hand hygiene and reapply gloves. I'm going to use my face shield if necessary, or if I feel the need to. I do not. I'm going to place my pulse ox on my patient's finger, and I'm going to get a baseline and keep it on there so that I can monitor it throughout the procedure. I'm going to place a towel over my patient. Don't want to get them all messy. I'm going to make sure my patient's in the high fowler's position and is comfortable. I'm going to gather all of my equipment, make sure that I have all of my sterile supplies that I need.
I'm going to
I'm then going to perform hand hygiene again and remove my gloves.
I'm going to whip my sterile cylinder before I put it in my dish.
Set this up to the side for a moment.
When I go up from this angle,
I'm going to start by opening this bad boy.
and then I'm going to open this.
Discarding my supplies properly. I'm going to keep my cap down. Put my sterile solution. Back up. I'm going to continue to monitor my patient while I'm getting all of this prepared.
Okay, I'm going to apply my own sterile gloves here. I perform hand hygiene before I do this process.
It's okay, it's a 1 inch border. These smell terrible. Sorry. Got these brand new gloves that are gonna help me. Maybe. These are soft.
Okay. I'm going to remove this glove.
Close one there. sure my machine is to 100 to 150 for an adult. Plug this in. This is now my non-sterile hand. I'm going to remove his mask. I'm going to hyperoxygenate in between sections because we can do it 3 times as needed. And to rinse. Until I meet resistance or he coughs. And then I'm going to back it out a half an inch, doing intermittent suction, swirling it between my thumb and forefinger. And do a second time. Hyperoxygenating in between if necessary. Not resistance, come back half an inch, swirl. Third, final time. Resistance, pull back. Here and again, suctioning. Turn on the machine. Just connect my tube. Make sure that my patient Got my hot mess here.
I am going to apply this. Apply this resistance.
I'm-
That.
Oh my god,
I'm
yes.
going to my suction pulling out. I'm going to rinse.
Oh, I'm going to reassess
I felt resistance.
my patient's respiratory rate.
Pull out and suction.
I'm going to compare their respiratory rate as well as their O2 stats to their previous. For him, his are getting much better there.
Apply. And that resistance, I'm going to pull back. And I'm going to suction.
I'm going to make sure that my patient is remaining comfortable.
I'm going to
I will put on gloves, perform hand hygiene, put on gloves, and provide oral care to my patient, making sure that I get any secretions out. And then I'm going to perform hand hygiene and get ready to replace his inner cannula.
Hand hygiene. I'm going to reapply gloves. At this time, I would apply oral hygiene for my patient. I would check their initial rate, or compare their pulse ox and their respiratory rate and dust to my
Sterile
initial
water in
reading. And
Down.
I agree with the actions of going to oral care. I'm going to
To open
reassess
my
their
inner
lung
cannula.
sounds. Clean that. Well, those sound a lot better. Okay. So what we're going to do is remove these. I'm going to perform hand hygiene. And I am going to, now I'm going to get set up. I'm going to hyperoxygenate when I'm setting up. And then we will change the cannula and we will clean the area around.
going to remove this by keeping it close by. Remove this old one. Place a new one. Discarding. I am then going to take away his dirty dressing here. I'm then going to perform hand hygiene. Throw on some of these non-sterile bad boys. I'm going to make sure that my patient's on oxygen as ordered, hyper-oxygenating as necessary. I'm going to then clean around this close by. I'm working from the stoma out in a circular. Throw away, get a new one. Throw away, get a new one. Throw away, new one. I can also use a 4x4. And I'm going to do the face plate. And I would just dip that in my sterile water. Okay, all cleaned up. I'm then going to remove my gloves and perform hand hygiene. Put new gloves on. I'm going to then replace his tie. Not these ones. Gloves love me today.
Is that what you saw?
Okay. I'm going to always put the new tie on while the old tie is still intact, or have somebody hold the trach in place because we don't want it to fall out. I'm going to make sure that as I'm putting this on, I would typically go to the other side of the bed. But in this case, we don't really have room, so we're making do. Make sure it's not too tight, not too loose. One fingertip underneath. I'm going to set the oxygen to whatever the doctor has ordered. I'm going to take care of all of my supplies. I'm going to make sure that my patient has his drain sponge back on. I'm going to make sure that the area around his tube looks clean, dry. Make sure that my patient is comfortable. I'm going to make sure that his bed is lowered to a safe level. I would remove this, discard all of my supplies, note his respiratory rate and pulse ox, remove my gloves, perform hand hygiene, and then I would document my procedure.